Chapter 32, Chronic Mental Health Disorders. Remember that chronic means long-lasting, persistent, or continual. Most chronic mental health problems follow a very wavy course that have periods of exacerbations and remissions. Exacerbations are periods of dysfunction that are accompanied by increase in the signs and symptoms and seriousness of an issue or a problem. Remissions are times of partial or complete disappearance of the symptoms. The course for chronic mental health problems follows this wavy and up and down cycle. In society today, individuals deal with chronic mental health issues and they're cared for in the community. Society expects them to provide for their own basic needs, protect themselves, and seek help for their problems, which are all complex behaviors. But the reality is that most of these chronic mental health issues that people have makes the individual unable to meet these expectations without assistance. A chemical restraint is a medication that acts on the central nervous system to reduce psychotic symptoms and to calm an individual's behavior. The issues that face individuals that have chronic mental health issues are the same as the rest of the issues that the rest of society faces. They need adequate food, shelter and clothing, gainful employment, a meaningful relationship, and access to health care. Most individuals that have chronic mental illnesses, they have to strive to meet their needs on a daily basis. Because their disorders prevent them from planning or logically carrying out an activity, many of these individuals are homeless, hungry, and unable to care for themselves. Individuals that experience chronic mental illness are often between the ages of 18 to 35 years old and severely ill, although most of them have never sought treatment. These individuals will lack internal controls and rarely take psychotropic medications, but yet exhibit excessive drug and alcohol abuse. There is no one single characteristic of chronic mental illness. These all depend upon the person and the way that they cope with the situation and reality. Behaviorally, most of these individuals have a difficult time functioning in society, and they have a difficult time with their own activities of daily living. Oftentimes, these individuals will be assaultive in behavior. They may have sexual behavior that places them against the norm of society. Physically, their mode of dress may be different, very unusual. They may have personal hygiene issues. These individuals may have different or severe intellectual, emotional, as well as social problems. They oftentimes will have low self-esteem, depression. They will feel lonely and hopeless. Chronic mental health issues can often begin at any stage in life, but they're usually not established and discovered until someone's in adulthood. Yet oftentimes they can begin as young as the child age or in the adolescent period. People that have chronic mental illness are at high risk for contracting HIV because of their current behaviors and their past history. Behavioral changes may result from an HIV infection if the virus invades the nervous system. 75% of individuals that have chronic mental illness use or abuse drugs. These individuals present a significant challenge for treatment because of the complexity of their mental disorders. When considering an inpatient stay, there's a pattern of admission that may be seen. It will be a short institutional stay, then discharge. There will be a short community stay, and then readmission into the inpatient facility. This is known as recidivism. This remains a chronic problem for healthcare professionals as well as the clientele. Outpatient settings for chronically ill individuals are often halfway houses or group living environments. Psychiatric rehabilitation will focus on a wide range of individual needs. This will include physical, emotional, intellectual, occupational, as well as spiritual needs. Unfortunately, too few psychiatric rehab programs exist for the many that truly need them. The goal behind the chronic mental illness therapy is to help the individual achieve a stability in their life and maintain their highest level of functioning for their own health and well-being. Anti-anxiety and antidepressant medications are often prescribed to help improve emotional comfort for chronic mental illness. Antipsychotic drugs are prescribed to help control hallucinations and symptoms of psychosis. These are the mainstay therapy for psychoses. The basic interventions for chronic mental illness include assessing the individual for risk of harm to self or others, encouraging the individual to notify the staff when they're hungry or when they have destructive thoughts, to frequently orient the individual to reality, to assess for delusions and hallucinations, to teach the individual distraction techniques to help them control the hallucinations, to schedule a specific time for grooming, eating, and sleeping. This helps encourage their responsibility and increases their self-esteem. To use effective listening to establish trust with these individuals. And to encourage good social skills and give positive praise whenever they meet the expectations.